Hello, I'm Cameron Dodge, a third-year family medicine resident in Lawton, working at one of the OSU branches in Oklahoma. I'm presenting my QI project on smoking cessation intervention documentation using a didactic lecture. My attending for a project was Dr. Stroud, our Associate Program Director. Background. Tobacco product use is the leading cause of preventable disease and death in the U.S. The prevalence of cigarette smoking in Oklahoma was roughly 15% in 2023. Since 2011, there's been an average decline in smoking prevalence of about 4% every year. The prevalence of quit attempts in the last year was about 50% in 2023. All adults should be screened for tobacco use and provided with behavioral interventions. Though the recommended therapy for resource-abundant areas is to use an integrated care plan with tobacco treatment specialists, data also supports using a quitline and pharmacotherapy for resource-limited areas. Standardized templates and regular lectures about tobacco cessation may improve adherence to regular screening from providers. Claim statement. My QI project is about appropriate documentation and billing for tobacco cessation. I create a template to standardize the diagnosis, billing, and have the conversation documented in the preventive medicine tab so people can carry forward that information and know the patient has gotten their counseling. I presented my template during didactics. My template also included imaging orders and USPSTF recommendations on CT low-dose scan and AAA screening. I collected data on adherence to tobacco cessation billing and documentation before and after I did a lecture introducing the template. The goal was for use of the CPT code to rise by 25% after a lecture. Methods. Residents and staff received a lecture on smoking cessation regarding how often patients should be screened for tobacco use, how often the physician should have a conversation about tobacco use, and treatments to aid tobacco cessation. Changes were made to already existing tobacco cessation template to include other common related discussions such as AAA screening and CT thorax. Data was collected on tobacco cessation interventions and the procedure codes for those conversations, 99406 and 99407. Conclusion, you'll see a picture of an autopsy showing the typical appearance of squamous cell carcinoma. It's a centrally occurring lung cancer with a necrotic mass that is nested away next to a major airways in the lungs. Please direct your eyes to chart 1 from November to April. 804 patients had a discussion with a resident physician concerning smoking cessation. Among those 804 patients, only 11 were billed for that discussion. Chart 2, there was a decrease in patients seen for tobacco cessation after a lecture, but there was also a decrease in the number of eligible patients. Chart 3, there was about a 75% compliance rate to tobacco cessation counseling both before and after a lecture was given, indicating no change. The billing for cessation counseling increased from 0.6 to 2.6% after my lecture, which was not the 25% increase I was looking for. Limits and next steps. This study has multiple limitations, such as small sample size, a single didactic lecture, lack of pertinent in-room reminders, and lack of integration into didactic structures. Involving multiple programs on tracking adherence to appropriate billing and documentation of screening for tobacco and for smoking intervention would improve the reliability of the study, which only involved one residency site. Ideally, such didactics on USPSTF recommendations would be standardized and repeated annually to introduce interns to appropriate topics and remind seniors of the importance of compliance to screening and template use. Placing models and images of important USPSTF topics in exam rooms can help remind providers and involve patients in the importance of regular screening and intervention. Didactics on templates and USPSTF screening will ideally be provided at the beginning of the residency year. If this study were to be repeated, the researchers should include appropriate documentation and billing of all USPSTF measures in lectures belonging to an annual series, include multiple residency sites, and follow the series across multiple years of those residency programs. Thank you for listening.